Pleasure and honor to introduce George Shaker to you. He's a professor at the University of Waterloo, and I believe in the announcement for the talk, we sent out a really nice, long and detailed bio, which I don't care to repeat. And instead, I would like to just highlight what I think is like the cool aspects of his background. Because unlike more traditional faculty members like myself, he actually started out in industry. And I think when you talk about health technologies, one of the important questions that we all have in academia is, how do we take the technology that we've developed as an academic and actually get it into real working systems and have companies commercialize it? And this is exactly what I think he does with great success, and which I think is a role model for a lot of us here, especially like young students who are aspiring to develop new health technologies. As you can see on his slide, he's also the founder and chief scientist of a company. He's affiliated with the Institute for Aging. And among other things that he's done, aside from what he's been described here, he was also one of the first people to get one of those piloted kits of Google Soli, where he kind of pioneered the first work in trying to measure blood pressure using radar. So he really has a lot of interesting, innovative work. And I'll kind of defer it to you so we can learn more about that. Yeah. Thank you very much.
Thank you for the invite, Sevgi. I really appreciate it. And happy to be here in Assist, Ravi. Look forward to learning more about this facility. I think the topic for today's talk is going to be on radars, digital twins, and the future, what they call the unseen heroes of tomorrow's technology. And it's going to be interactive, so stop me anytime you have questions. Otherwise, I'll keep talking forever. I wear multiple hats, as Sevgi mentioned. One of them is being involved with the IEEE. I don't know if there's an IEEE sensor section here or not. Is there one? APS section, is there one? Or
I know we have like a general IEEE student chapter. I don't know if we have specific society chapters.
Okay, so it might be worth to encourage the students to start looking into ones. And the reasons are between sensors, MTT, and APS. I'm involved in all three in a way, but heavily involved managing the grants for the APS Society. And I can tell you there's lots of money to give to students every year. And what I'm noticing is lots of students are not aware of these opportunities, or I think it's very challenging to get to those. Some of them are really easy. Like I'll give you an example. This year we have about 50 fellowships. So each fellowship is at $5K, and you can take that to run a research project on your own with a supervisor of choice. So that's actually the success rate in that is almost 50%. We have another one, which is the travel grants. The success rate on those is almost 70 to 80%. And travel grants help you go to the flagship conference. You get a couple of, basically 2K USD to help with the travel expenses. Another one is the actual paper grants, and we have, again, lots of those. I think the message here is, the message here is it's a good idea to look at these closely, whether the ones from APS, MTTS, and sensors. The other piece is I really encourage you to have your own local society chapter here. The reason is the student one. The reason is with that, you get lots of funding coming in to the activities of that chapter. You invite people from outside, and the IEEE pays for that. The other piece, which is a huge benefit for the students, is the fact that the chair and the vice chair can receive funding to travel to IEEE flagship events once every other year. So it helps a lot of students get involved with IEEE during their studies. That's the whole idea, just encourage their participation. So I'll leave it there, maybe talk to Sevgi about it. The application is very simple. You need a supervisor, faculty supervisor, 6 student members. And from there, you can have lots of opportunities unlocked. Now let's switch to the more technical stuff. So to give you a bit of an idea about my lab is called the Wireless Sensors and Devices Lab. I started that back in roughly 2013, 2014 timeframe. We focus initially on just antenna systems, but as you can see in that area, I don't know if I don't think I have a mouse or a laser pointer, but as you can see in that area, we have under that theme, we have wireless power transfer work. We have radio sensing that covers microwave all the way to millimeter wave and sub-terahertz. We have actuation, and the big thing, of course, we have data transfer. So all things related to 5G and beyond, we have been doing all these within the lab. I've been fortunate to have all these companies with all those logos involved in the lab research heavily. So we have had funding from each of them. We did lots of joint projects with many of those. Some of the unique facilities we have that help this work is an antenna chamber that actually, I was at BlackBerry at the time when we released the 5 million initial investment to the university to build this chamber. So it's a large chamber. You can fit a car into it, and then can do all sorts of AMC and antenna measurements in there. We also have a unique facility with robotics. We have state-of-the-art robots in a way, and we have been equipping those with all sorts of wireless radios for communication and for sensing. I'll talk a bit later about a couple of the projects we had with automotive players, but we were fortunate to receive some cars as a donation from some of our partners, and we actually received the first autonomous license a few years back in Canada to run autonomous vehicle research. I was told I'm the only faculty member who has a truck and a trailer as part of the research group. So in that trailer, you'll see there, we have been doing lots of interesting developments. And then one of the ones that are very close to my heart is what we call the RIA apartment, the Research Institute for Aging apartment. Basically, I have a living lab there, and that's the image to the bottom right there. There, it's almost like an apartment where it's a replica of where the older adults live nearby. We are part of a retirement and nursing home. So we have about 2,000 residents that have access to this living lab. And we recruit participants from these labs, like sometimes almost on a daily level. So this is the core of some of the stuff I'm going to show you. I think Sevgi mentioned earlier the industry participation. I was fortunate to be involved in a few startups along the journey. Some were successful, some were not, and success is relative. So it's something that I actually enjoy talking about. And I actually have a seminar on starting how to start a startup that I do sometimes from time to time. But anyways, we can talk a bit about those in extended discussions later on. Always happy to talk about these ones. So the flow for today's talk, I'm going to talk initially about our early work employing radio detection and ranging, then our approach for near field sensing, and from there, some of our work on near field biomedical sensing, and some of the stuff we have done in LTCs, long-term care homes, and hospitals, and then some notable byproducts in the automotive domain and in the mining domain, and then some ideas about the AI guardians using digital twins. So I'm assuming most of you know about radars, radio detection and ranging. This is in traffics, you get lots of ticketing or tickets because of speeding. But originally, the whole idea started with acoustic sensing. So in the World War I's and II's, they were listening to incoming flights using just their ears, right? And then from there, it evolved a bit. This is the top right image. There is one of the early implementations of radars in the UK. The one here is what we see around in airports. It's common everywhere now. And if you have seen these in real life or maybe in movies, it's a screen with lots of dots. And the idea is to figure out the real dot, the real object, the plane, for example, from the clutter. So that's the exercise typically there. Now, if you think about it, we're trying to do detection using radars. Remember, it's radio detection and ranging. But the challenging problem is usually even more challenging than detection is classification. So we want to figure out, for example, if an incoming flight, which model is that plane? So that's a very important piece. For the purpose of the talk today, we're going to stick to a class of radars called frequency modulated continuous wave. So radars can be many classes. Some of them are continuous wave, some are frequency modulated, some are pulse modulated. So there are different ones, but just to keep things simple, what we're focused on is what we call an FMCW wave generator that transmits signal. The signal comes back, is mixed, and then through some baseband processing, we can figure out some pieces of info. The key ones that we're trying to figure out is the range, how far that object is from the radar, and the speed that object is going at. So this is a relatively simple architecture to build. It's one of the lower cost ones, and it's a popular one. Of course, when designing architectures like this in radars, you have to think about, okay, what is the frequency that you're going to choose for the radar? What field of view would your radar have, right? And what's the distance that the radar will be able to cover? And what's the range resolution? And there's multiple resolutions there: range resolution, velocity resolution, angular resolution. The whole idea of all these resolutions is if you figure out, or if you think about two objects coming by, you need to be able to resolve them. They could be very close to each other in the angle or in this distance, right? So you need to be able to resolve them. So these are all specs that you have to define as a system designer first. And then usually those translate into some antenna design requirements, some RF system design requirements, and then software requirements. And there's a layer that I find lots of people are not aware of, which is the firmware design. So firmware is really the software that's designed not to the user side of things, but more to the control the hardware piece, right? So, and keep those equations in mind. We're not going to go through why these equations or how to derive them. Many of you might be familiar with those through your courses, but just remember those ones. The first one, which relates the range resolution to the speed of light and the bandwidth of the system, that's B. And the last equation there, which is the angular resolution, which is function of the number of antennas on a system. So let's take the gesture recognition. I think Professor Gerbers is very well known for all her work on gestures, but actually that's how we started working in this area. The idea was a bit simple. So radars have been used to detect planes coming in for quite some number of years. The question was, and this question was posed by a team at Google, can we take the same concept and put this in a smartphone, right? So the idea was, can we put a radar in a smartphone and detect gestures, right? So think about these gestures there, right? If you look at the basic equations we discussed, and if you want to resolve the distance between these fingers, for example, you will realize quickly that we need a bandwidth of about 30 gigahertz to be able to resolve these fingers at a 1 meter distance from them, right? So that's 30 gigahertz is very, very challenging for those of you who work in the RF domain. The other piece is the aperture, right? So that radar needs to have an aperture of about 150 meters if you're working at 1 gigahertz, right? So larger than this building. Or the other piece, if you go all the way to 100 gigahertz, you need an aperture of 1.5 meter, still very large for a cell phone. So initially it looked like, everybody's crazy trying to do this work on this problem, but we have another feature there that is very important, the fact that gestures are repeatable across different people. If I'm pointing at any person there, there's a time factor, right? And it's repeatable. If I do it, somebody else does it, it's almost identical, right? Gestures among people are very, very similar. So we use this part or this fact, the fact that the gestures take their time, right? So there's a time factor and the fact they are repeatable across different people. And then we decided to try to go for a larger frequency because we knew higher frequency things go a bit smaller. So with it's optimization on the cost and all of these things. But we said, okay, let's use the mouse is working. Yeah. So let's use this architecture there. Let's see a traditional radar architecture, but add to it a machine learning layer. And the idea there is we are showing the radar how a simple gesture looks like by different individuals. And maybe then the hope at the time was, if the radar can learn that with the machine learning, maybe we can use it reliably for some gesture recognition. So it looks something like this. Basically, that's the architecture. And for example, this is a micro Doppler for a hand swipe, right? So it looks like, okay, here is how it looks like. We feed that to the machine learning layer from different people, right? So it learns how it looks like across different population, and then let's see if we're lucky or not. So this was the basis of that project or that idea at the time. As Professor Gerbers mentioned, I was fortunate to work closely with Google team on that since inception almost. That was part of the Soli platform. And these are some of the demos we had achieved after a number of years going back and forth and trying to pull everything possible we can do together. So basically, this is the actual architecture of the radar. This is the small white box there. These were simple gestures after the radar was trained to be able to control the screen on a TV, a browser screen, basically. So simple gestures like knob turn on, turn down, so you can control the volume, things along these lines. So that was one of the big demos. I think everybody was excited about these ones. Another fun demo was the fact that we took this to a Cadillac, and we showcased that we can repeat the whole thing, controlling the infotainment system of a vehicle. So this way, you don't have to touch the screen. You can just wave at the screen and you control it. The beauty of something like this, if you think about it, is now less distraction for the driver, works for both the driver, the front passenger, and depending on the location of the radar, we actually made it work for the rear passengers as well. So this way, you don't have to touch the screen whatsoever. You're doing it completely remotely there. So these were the early works that we have done. I think we took the work a bit further. For those of you who know, Google actually pushed this technology into phones eventually in the 2018 timeframe, where they released the Pixel 4 phone, and that had this chipset working. We continued trying to figure out applications beyond gestures for that technology. So one of the things we tried was, okay, let's build a model for this radar and try to see if it can count cards. It was at some point, let's see what it can do, right? So these are some of the early attempts from theory or from simulations and numerical electromagnetic simulations. It looked like we should be able to push the radars to be able to classify cards, for example. And here's one actual demo of this tech where basically we're counting cards. We are actually identifying credit cards, different ones. If you're using it for playing Lego, we are identifying missing pieces, identifying domino pieces. We showcase many different use cases with this smaller platform in there. One of the things also we showcased is the fact that because we can now use the radar to identify different objects, we realized at the time that we as humans have not only unique thumbprints, but also unique vein prints. So we use the system to look into the veins of different people. Again, the same idea. We trained the system across very different positions for the hand. The system realized, okay, this is this person, but with different hand positions. And then here's a demo where when it's dark blue, there is nobody. When there is lighter blue, there is person number A, for example. They remove their hand, the system realizes nobody's there. Another person comes in and it realizes, oh, this is the person with the orange label there. So we showcase that, yeah, we can identify people nicely with this technology. The beauty of this, actually, if you're familiar with what's happening and this high secure applications with the thumbprints, people can take your thumbprint and then replicate it with a high or advanced 3D print, silicon print. So it's very easy to do. But with this tech, it's almost impossible because people will need to cut your hand somehow, right? And then even if they do that, they're going to drain the blood out of it, so it doesn't have the same properties, so it's going to look different. So even with that, it's not going to work, right? So it's actually a technology now that's used in quite a number of high secure facilities for access control. Another application we notice is, okay, if we're looking into different objects and identifying in a way if they're different from each other or not, why don't we apply it for liquids? And here we showcase that we can identify Diet Coke, Zero Coke, regular Coke nicely. And this is interesting because we had a number of projects based on this. One was with a nice distiller in Scotland. They had a problem actually with Scotch being faked across different interesting destinations. So they wanted to see, okay, if there is a way to point your phone, for example, at the bottle and it tell you if it's authentic or not. Use the same approach. We trained the system on the gold standard of the bottles after they package them. And then from there, if you go in the field, if somebody faked it somehow, we can latch on that. Of course, there are ways to go around this. We can discuss them later. But for the typical methods for basically playing a bit, the typical tricks that they used to play in faking Scotch, this was a good enough approach. Also for oil, actually gutter oil is a big issue. In certain countries, people will take used oil and filter it quickly in a way and reuse it as if it's a brand new oil. It's a major issue for olive oil coming in from certain countries. So we also showcase that this is we can detect these fake oils very quickly with the same approach. One of the big showcases of this technology that's now being used in industry as well is the fact that we showcase that we can detect if milk cartons have a different concentration of fats as they go in a conveyor belt. So if you basically, I don't think many of you are aware of this, but basically milk cartons, the way the industry works is you have a certain fat concentration on these, and if it deviates by about 0.5%, you have to recall them. And the way that milk producers do it is every now and then they take few samples and do destructive testing on these milk cartons. And if they realize that the fat concentration is different, they have to go back and take almost a full pallet, destroy it, and then rework the milk and repackage it again. So it's a major issue. So what we ended up doing is we trained the system, again, trained the radar on the proper concentration. Let's say we are looking for a 3.25%. So it's trained for that. If the system detects any deviation in the fat concentration, flags it as it goes on the conveyor belt. And then this became another interesting use case for something along these lines. So this was an intro for many of the stuff that we have done over the years. The radar itself, we are not married to one radar or the other. We actually work very closely with different vendors. I mentioned Soli earlier. So Soli was a partnership between Google and Infineon. And we have been working since, as I said, 2014 or so with Infineon very closely on multiple iterations of these radars. We also did lots of work with TI, Texas Instruments. Vyar, which is an Israeli company, has been doing very interesting work for a number of years. IMST and some others. And then most of the radars, you see many of them in the photos here covering between sub-gigahertz all the way to 120 gigahertz. And in all of these works, I think we had a fundamental set of questions that we've been trying to address. Some of them are, okay, we talked earlier about the field of view. So what are the good antenna designs that we need to have for a given field of view? What if we bypass antennas when we're working on the near field and do something else? So I'm going to talk about it in a bit. What if we pair the radars with maybe nanomaterials and do something very, very advanced? And I had a project with the US Army Research Labs on this area, so I'll cover it. And then how to synchronize multiple radio chipsets. That's a big one. So sometimes you cannot, or you do not want to use one radar. You want to use an array of radars. What's the optimum antenna design if you want to have a very wide field of view in certain applications, like, for example, in the living lab? There's lots of antenna packaging limitations, so I'll touch on those. And then, again, if you think about it, what ML AI should be used? Like I talked about the fact that the whole architecture here is based on a radar plus ML AI. But the question is, what's the ultimate ML/AI algorithm that you should use to work best with the radars, right? So some of these are questions that I think we answered. Some of them I think are still open-ended questions, and more research is needed into those areas. This is a bit more for the students there. I know when we talk radars, people think it has to be complex. And what I'm showing there is actually the iterations from Google's first 5.8 gigahertz radar all the way to what we did with IMST in 24, and then eventually to the Soli 2x4 chip. And we have been doing lots of measurements internally. We actually had a custom-built robot in my lab where to be able to define how the chip is working. And we did some measurements. Sometimes we left the radar working for a week in a chamber to see how stable it is. So sometimes we think it has to be complex, but I think sometimes we also have to simplify things big time. Like when we started looking at trying to figure out if radars can be used for heart rate and breathing rate sensing, you could go and invite people and do all sorts of ethics initially. But one thing that could be much simpler, and I like this experiment a lot, we actually built a jig that had two motors, right? One going at a speed that corresponds to the typical breathing rate, and one that corresponds to the speed of a heart rate. And only when we got this to work, because you can control the speeds of these motors nicely, only when this started working, we went ahead and applied for ethics, and we did work with actual people. So sometimes this jig costs us less than $100 to build, but you could calibrate your platform very nicely with something like this. You don't need the expensive $1 million lab sometimes. Some simple stuff are really useful sometimes, right? So I'm going to talk about two health applications here. One which focuses on blood glucose levels, and the other is going to talk more about the cardiovascular system. So I think many of you are aware, trying to monitor diabetes is a big issue. The reasons are, of course, diabetics could suffer from strokes, blindness, heart attacks, kidney failures, or limb amputation. So it's a serious issue. What exists in the market today are a couple of technologies to monitor glucose levels. One of them relies on a glucometer. So you have a device and you have a finger prick. There's a droplet of blood, electrochemical reaction or chemical reaction there. And then from there, you can take a reading of your glucose levels. That's one, but the problem with that one, there's so many problems with that one. One of them is the fact that it can lead to infections. Many people cannot handle the sight of blood. That's a big one. And for certain populations like infants or younger kids, or during pregnancies, gestational diabetes, for example, those are things that become really, really painful because you have to take measurements a lot. So glucometers are not the best there. The alternative is devices like the Dexcom or Freestyle there, where basically it's a wearable device that you put on the shoulder or the abdomen and tries to make the readings. Again, there is a pricking of the skin there, so that's a problem. It could lead to infections. I was involved in a in a lawsuit against one of these big players at some point. I was brought in as an expert. And if you look at the claims it was a bit interesting there what was going on, but the whole issue was that these needles were breaking into the skin and causing huge health risks. So again, well, didn't seem like these two are, even though this is now becoming a popular approach, but still the complications are a bit significant there. So there is a reason why we may want to look at alternative to pricking in general. My approach to this was a few years back, worked with a couple of my grad students, and we tried to put the glucose monitoring system in a smart contact lens. So what we tried to do is was a bit crazy at the time. Again, lots of interesting work with Google at the time, but the idea was maybe we can monitor the glucose in the tear fluid. And we went ahead, built our own iteration of that platform. The idea was we built a smart contact lens that will harvest energy from a phone. So if you hold the phone, your phone is sending data all the time, even if you are not making a phone call, it's just communicating with the base stations. If you are holding it like this, we designed the smart contact lens to capture some of that energy. And when it captures that some of that energy, it will power electronics on board to do some glucose measurement. And then since this phone, once you run an app there, that app will send a Wi-Fi signal directed to the eye. The eye will modulate it based on the readings and send it back as a Bluetooth signal. And then this way the phone can read your glucose levels in the tear fluid. So this is actually one of the projects where we got a number of awards for this work. We got quite a significant investment, but actually this is one of the cases where the company failed. We spun off this company and it failed. And I can share lots of stories about it later on, a few millions burned in that one. But this is an example where there are many factors that you cannot control in an idea like this. But one of the big one is the fact that this smart contact lens had a chip, a smaller chip in there. And neither us nor Google nor J&J, all the big players in this area, nobody could figure out a way to make it comfortable enough for the users, right? And that's actually one of the reasons why this was killed. But we learned a lot during that exercise, and well, we tried to figure out, okay, what can we do that learning from this that will still help solve this problem of non-invasive in a way or semi-invasive glucose monitoring. During about 2014, 2017 timeframe, there was some works happening at JPL and then later on in Oxford in the UK. And the ideas there were a bit different. The idea was, okay, what if we use a VNA? VNA, for those of you who don't know, is a vector network analyzer. It's a very expensive box to do RF measurements. What if we figure out a way to clamp some type of a probe around the ears, for example, of mice or rats, and then see if there's any relation between glucose levels and RF measurements. And Peter Schlegel group out of JPL actually showcased that, yes, there is a very nice correlation between changes in glucose levels in rats and RF signals. And then later on, it's almost the same experiment was repeated in the UK, but rather than rats, they used people. So they verified this as a possibility. So the timing was interesting because we were coming out of this smart contact lens. This is the works there. And then, of course, the question was, okay, so this is great, but then they're using VNAs. A VNA is a $500,000 box or so. It's very expensive. It's not going to be wearable. What can we do, right? So then we came through the concept, okay, what if we start marrying all the ideas we've had? And in a way, what if we create our own version of a glucometer, but with a radar chip, no VNA? And let's see if we can get this to work. Or maybe let's try to go after a smartwatch that will have a radar into it, and then also try to see if we can track glucose level changes. So these were the two goals. And to start, we tried to do something very basic because still we had a couple of interesting results in the field at the time from JPL and from Oxford about the fact that there's some correlation between RF signals and the glucose in the bloodstream, but we never had a complete study in this, or we weren't aware of any complete study during that time. So what we did is we actually ran our own campaign of collecting blood samples, and we acquired a device from a Swiss company to do very basic blood characterization. And the idea is, for all these blood samples, we do a blood work on them, figure out the glucose levels, and do RF measurements using this piece of equipment and try to see if the correlation stays across a wide spectrum. What we learned through this study is a few things. So this is actually me running a blood test tube there connected to the VNA. So almost repeating what the others did, but instead of actually what you have seen on mice or with people, we're doing it with blood test tubes. And we actually found that there is a range of frequencies that we can sense changes nicely there. That's actually about the millimeter wave, 55 to 60 gigahertz range. And that was a bit interesting finding because our Soli platform was working from 57 to 64, right? So we decided, okay, what if now we start using Soli to trickle to blood test tubes and see if we can use them to figure out if there is any changes in the glucose levels in the blood. And indeed, this is some of the very early findings we had. This is actually a result for 0.5 milligram per milliliter. This is another one where 3 milligram per milliliter. You can see that the results are very repeatable. So you can take this blood test tube, put another blood test tube with the same glucose concentration, and the results are very nicely repeatable. And they looked very different too, which was lovely because that could mean that if we train the system enough on different samples, the machine learning will latch into these and can be able to detect glucose changes later on. So this was the early results that we got. We went ahead and designed a full-blown platform. This is the one on the top right there, fits in a smartwatch. Of course, if you're putting a radar directly on the skin, there's so many challenges you have to solve. You don't want, like these chips were actually designed for further away operation. So now when you put them on the body, they're not designed for that. So what can you do? And this is one solution that we came up with. We actually used the same chip. It's a variant from the Soli a bit. It's a simplified variant. It's 1x3 only. But the idea we did is we added a matching layer on top of the antennas, the on-chip antennas. The whole purpose of that matching layer was to be able to focus the energy into the skin. If you think about it, it's not that straightforward because if you have a radar, like think about it this way, if you have your radar looking into the skin, if all the energy goes into the skin and nothing is reflected back, that radar is not going to work, right? You lost complete visibility. And if everything is reflected back from the skin, you also have no visibility about the glucose inside the skin. So there's an optimization process there. So you're trying to figure out the sweet spot where the system will work, still sensitive enough to change it in glucose. So there's lots of iterations where we got a spectrum analyzer and we built a model with like a simple connection to that spectrum analyzer, and we tried to see, okay, are we reading enough coupling between the radar antennas and the same time seeing into the samples there. So there's lots happening in the background of this one, but I want to show you some of the results that we have had. You can read through the papers there, but here's the transmit power into the sample. So you can see huge improvement into that sample, but in the same time, you can see a nice TX to TX and TX to RX coupling there. So basically, that means that the radar was, once we added that matching layer, we could sense more into that sample and then do a better reading in there. That transferred to few dBs in improvement of SNR. But then what we quickly learned is the system is really sensitive to placements, right? So we had this lens, if you say, flat lens on top of the radar. So you place it on the skin, but if you place it a bit to the right, a bit to the left, you may be placing it on top of a vein or something, and then the readings will change. So of course you can make the watch very tight to get it to work. It's not as pleasant, right? So what we try to do is then, okay, what if we create multiple, so think about it as a smart band with multiple radars. This way we can get the data from several of them, and then from the suite of these radars, we can have a more accurate result. So this is the concept, and this is one of the early iterations. So instead of having it as a watch, we had it around the shoulder or near the shoulder area there, and then we showcased that, well, we can get very, very nice improvement in terms of again, energy into the sample and also coupling between the TX to RX antennas. To improve things a bit further, we created a multi-band radar. So actually, to get better and better results, we had several bands operating at the same time. So what we have today is a platform that's fully wearable. It's like a bracelet, and that one runs multiple radars. and each of these radars run at different frequencies simultaneously. So this way, with all this data coming back, we can do some data cleaning, and then through the machine learning, we can latch into good glucose readings in there. So that was one approach, but then which is now going through lots of again larger scale clinical trials. During all this work, we realized something a bit different there. So we're going after glucose, remember that. But if you put your fingers on top of this area, for example, you'll be able to sense the pulsations coming in, right? So what we did is, okay, what if we put the radar in a similar way? Can we sense these pulsations or not? Of course, lots of modeling happening there. So I don't know if you can see it on top there, but this is an actual electromagnetic simulation, and there is a pulsation happening there. You can see it more here. So this is actually, there's a moving object simulating the vein motion there. And we showcased first in modeling that this should, in theory, work. So we took it to measurement. So what you see in the bottom right is an actual measurement there. So this is the radar placed on top of your veins in there, and it's actually latching up to the motion very nicely against the gold standard. So this was really interesting because that meant that we could possibly extend this work to be able to do some advanced ECG monitoring or something like this. So now, depending on how many radars you have, some of them will be maybe doing glucose monitoring, the others are doing some advanced ECG monitoring. Remember, initially when I mentioned we had two goals, one is a smart like watch, the other one is replacing the glucometer. So we went ahead and tried to do that. And again, for replacing the glucometer, the idea was, what if we put our finger on the radar, and that radar will be able to sense the changes in glucose? So to do it, we had different concepts. Some of them, you place the whole finger across the device or only the fingertip. We tried different approaches. These are some of the iterations we had in that journey. You can go ahead and read some of many related papers to this, but this is one of the I would say more complete demos that we've had. This is the radar architecture. This is actually based on a 2.4 gigahertz architecture called from MIT. It's the CAN radar. We took the cans out of it and replaced the antennas with our high sensitivity sensor. And the whole idea was, okay, let's train the system with different glucose levels, different readings, and different subjects. And then this is actually the results that we have had connecting the system to a laptop to do just the processing. You can see how nice before a meal and after meal the readings are. So this is a glucometer where there's finger pricking. This is our sensor, radar sensor-based approach, and you can see it correlates very well. So we showcase that with an approach like this, we can track glucose readings nicely in there.
So, George, can I
Yes.
ask you a question?
Yes.
To understand basically this glucose sensing, I think we are looking into the reflected power here, right?
Not just the reflected power.
Do we have like other, because I'm thinking about, is there a range change or a Doppler change? I understand the pulsing.
Correct.
Creates...
This one, so with the radar, yeah, with the pulsation, that's the Doppler. But
Yeah.
with the glucose, there's no Doppler there. What we're trying to latch on is the changes in the blood glucose levels that will impact RF properties, right? So when the RF properties,
that reflects in the reflected power.
not only the reflected power, because the signal propagation will change, so there is a signal delay coming back, right? So we have features that we're trying to latch on, but just the reflected power is a simplification there. It's a compounded factor, but one of them is the reflected power.
I understand.
Right.
In terms of, I think, wave propagation speed, definitely kind of the densities changes or
Correct.
permittivity changes, but does it?
But the other
changing in a short.
Well, that's the beauty of trying to do it this way, because now we're using don't think antenna propagation anymore. This is all in the near field. So if the dielectric properties change and you're loading a resonator, you can throw off the resonator big time.
Okay.
And that's what you're latching on.
And my other question is a little bit, okay, glucose changes,
Yes.
leads these type of,
Yes.
at different frequencies, the observations changes definitely. But is it the only kind of contributor to
No.
these kind of changes?
No, it's not. And
Because there should be
yeah.
other kind of contents in.
that's why you don't see this in a product yet. Okay. There are many other factors into that will change the RF properties of blood. So we have a study that we showcased that different medications will impact the blood properties, in some cases even similar to changes because of glucose changes. So aspirin, for example, that's high doses, not low doses. High doses of aspirin can lead to significant changes. High doses of Advil will also almost lead to significant changes. So the question is how you differentiate between the change being because of glucose or because of a medication, for example.
Do we have a
Nobody.
physical model that really relates this glucose to the permittivity
Yeah,
levels and then?
We have that done. The big challenge though is how do you solve this problem, right? So there are few approaches. Some are going back to the approach of, okay, let's do some type of microneedling patch that will have a semi-invasive approach, maybe not as invasive as the glucometer one, but still gives you something from the interstitial fluid. And from there, you can do a hybrid approach. That's one. There's the other approach of let's rely on the fact that if there is a user and they're interested in these readings, they usually have a phone to go along the stick. And if they have a phone, they can enter what medications they are on and what food they are taking. And then we can use that to start looking at the data and clean it. So this is the second approach is the one that most of the big players are looking at because, well, it's easier to get this into the market, right? And then, yeah, it's going to take a while for this because of these issues and nobody has complete solution to it yet. Right?
So George,
Yes.
do you expect person to person variability as in when it becomes a product?
Yes.
Would there be some kind of a calibration involved?
Yeah.
Every time a new person wants to use it?
Yeah, so the short answer is I believe so, yes. My wife had gestational diabetes, and when it's a bit interesting, they give her 2 glucometers, right? And each glucometer gave her different results, right? So she will test at the same time, and she's getting different results. And the way they handled it in Canada was, okay, you have to see a specialist. The specialist will prescribe blood work, and you go once a week for a blood work to calibrate these two together. Okay. And then the readings were never the same, but you have a calibration against blood work, and you keep measuring during the week, and you're allowed the silted tolerance there. So in a way, that's the state of the art in the medical domain, at least. This is the practice in Canada. So going back here, the challenge is the fact that you're using a sensor to sense changes in the RF properties. But the base results or the base data is function of the skin type, which again, depending on somebody who's maybe heavier in weight compared to somebody else, they're again different ethnic backgrounds. All of this impacts the skin properties. So you need to calibrate that out. So the way we see it is you have to do again a blood calibration initially. Once it's calibrated for that person, then the changes up and down can be read properly. Yeah. But that calibration, again, one of the challenges that we couldn't figure out a smarter way to handle yet. So along the lines of trying to figure out a smarter way to handle the calibration and be a bit more specific is a recent work where I have one of my grad students, she's into fashion and stuff. So we decided to try something along the lines of because we have a platform that's small and can fit in a smartwatch. What if we put it in an earring? Because if you think about it, the earlobe is a nice flat area there. And if you put the sensor here, you can do a nice reading. So we decided to try to put the radar plus an optical sensor there and do a sensor fusion. The idea there is with optics, we know that you can track glucose in an interesting different mechanism than in the RF domain. And if we blend the two together, maybe we have a more accurate system that doesn't require as extensive calibration, for example. So this is still work in the progress. We have an earring prototype. We have results that we have results that showcase, yeah, I mentioned that up there, that if you use the two sensors together, you're down to about 5% or so, less than 5% error there, compared to almost 15% of an error with one modality there. So this is we're chasing this, we'll see where we go, but so far the results are really, really nice. And I feel like that combo approach or hybrid approach is going to be the way to go to eliminate the impact of certain medications particularly. One thing we're trying to figure out, and we haven't solved that yet, is for given medications, can we find an optical residual signal there? Because if we could figure it out, then we use that as our input to calibrate for glucose readings. So we'll see if we get lucky in that domain or not. Now, switching gears a bit to another medical issue, which is COPD. COPD is a chronic obstructive pulmonary disease. When we started looking into this, it was because of a cardiovascular surgeon who reached out to me and said, they seen some of the work we have been doing in the radar domain, and he was interested to see if there's any way to use the radars to monitor COPD. The reason is, if you think about it, COPD is very hard to diagnose and monitor. You have to go to a hospital, and I'm not sure how it is here, to be honest, but in Canada, you have to go to a hospital, you have a spirometer device, you have to breathe into that, or you have a very complex EIT, electroimpedance topography device, around the chest. And those are the ways that nurses have to basically administer these two. And depending on the results, they can diagnose a COPD. There's no way to take it home. And our wait times in Canada are horrible now. So to get this test done, you could easily wait 18 months or above. So it's quite a significant wait time. So people are not happy, doctors are not happy, patients are dying. And if you look at the wearables domain out there, of course, the Apple Watch is great, but it can never give you any data related to the proper breathing mechanism. People want to use this on treadmills, for example, but there's nothing. Treadmills, you know how annoying it is trying to hold to the handles, and you only get something related to the heart rate, nothing about the breathing there. And then if you go a bit more extreme and try to wear something like the Hexoskin, which is a smart shirt, or the Frontier belt, those are very finicky because they are based on electrodes, and the electrodes have to be touching the skin nicely there. And like the Hexoskin, for example, a few times after washing, they're no longer usable. The wires get damaged easily in there. So there is need for a tech that can monitor how people breathe, and from there maybe be able to diagnose COPD. So that's why we got interested in this, and what we did is we used what we had on the wrist, and we decided to put it in a belt around the abdomen. And it's an array of radars that's basically monitoring changes and how the people are breathing. And we showcased that, well, in a study against a full-blown wire system, we can actually detect many of the same features a wire system is detecting with a simple array like that. The beauty, of course, of using the radar against the electrodes-based systems like the one from Hexoskin or Frontier is the fact that it doesn't require touching the skin. So, and it's very painful if you put the electrode-based systems on the skin. This one, no touching. You can wear it over the t-shirt and it's still gonna get you the same results. I have a couple of images to the right there. The reason is, again, doing this type of work, we stumbled across another need in a hospital. And basically the idea was, can we monitor infants when they are born? Because some of them, they have cracks in their cranial vault. So basically they have cracks in the skull. And the way they monitor them in the hospitals, you have to go through multiple MRIs or CT scans to be able to monitor how it's healing. So we figure out, okay, using the same principles, again, this is a system where you can put a radar around it, and then you're just looking for changes. If there are changes, you could assume, well, depending on how you teach the radar, you can detect if it's a good change or a bad change, if it's healing or widening. And again, if you think about it, it's the same principle, but it's a use case that a couple of hospitals in Sweden have been using now reliably for screening quickly the kids or the infants before taking them to MRI. So this way they decrease the amount of MRI or CT scans done. Now, with what we have been doing and trying to monitor COPD and others, came the question from the RIA folks and older adults is, okay, so it's good to have a wearable on an older adult, but the problem is who's responsible for charging it? Who's responsible for cleaning it from time to time and things along these lines? So we had to ask, can you extract as many signals as you can with the wearables, but without the wearable, right? So the idea was, okay, can we emit wireless signals, hit a person, no dedicated wearable, and then decode the reflected signals and correlate them to some biomarker. So this was the ask there. I think I'm running short on time, so I'm gonna skip through some of this. When we started doing this work, I wanna give huge credit to some of the earlier works from people like Ali Fathi in Tennessee and Olga from Hawaii. These guys like did amazing work prior to us, but they were not using FMCW radar. They were using ultra wideband radar. It had its own challenges. we think we crack some things with using the FMCW, but let me scroll through this a bit quickly. And the idea was that we wanted to, again, remember what I mentioned earlier, we wanted to use the radar to monitor breathing rate, heart rate, and even more on people without any wearables. So I mentioned this demo earlier, right? You have seen that. Before working with actual older adults, we actually did this as well. So we had a doll from Walmart, inserted a motor inside that doll, and tried to get an actual model of a breathing there, and mini model for heart pulsations. And again, we tried to play with the radar distance to see if we can figure out the breathing rate or the motion of that motor accurately at a distance. Only when we managed to do that, we moved into something like this, where we had a radar and a ceiling looking at one subject. We got a couple of signals extracted, looked fairly okay as breathing waveform and heart waveform. That encouraged us to go and do a full-blown study, again, against trying to figure out how accurate we can get. We are in the 94% in terms of correlation accuracy there, but in the breathing comparison, and also like 80s, in the range of 80s in terms of the heart rate. Since this, I think, this area, I think, became a very hot area in research. It's almost 6-7 years now, and lots of teams are pushing this even further now. So it's it became I think it became a good story there. One thing we realized early when we're doing this is if you think about all these radars, you have a radar plus a machine learning. Where is that machine learning? Is it done on the edge or is it done on the cloud? And early when we started looking at this, of course, if you think about the Google phone, well, it's on the edge in a way. The phone is powerful enough to do some edge compute. But when we started trying to put these in a retirement home and a nursing home, we had so many options. We could put the radar in the ceiling, put it by the wall mounts and beside the bed and all of these. And when you think about it, the question is, are you going to do edge compute in all these scenarios or cloud? And I felt maybe we should go for the cloud-based approach. There are many reasons why, but if you think about it, again, go back to the basic idea. The basic idea is you have a radar plus machine learning. The machine learning has to see certain scenarios to learn them, and then this way it can detect them later. If that's the approach we're doing, then the question is now, if we do all of this on the edge, we're in a way limited adding more features to the system, because every time we want to add a feature, that edge has to, again, learn how it looks like before it implements it. Whereas if we push everything to the cloud, then our sensors become a bit low cost. They don't have to have any edge compute. They don't have to have a GPU. They don't have to have any of the advanced computations there. Everything goes to the cloud. The cloud can be as fancy as possible, pulling the data from hundreds, thousands of sensors. We change algorithms all on the cloud and then push them back to the device. So this was the approach. So we actually, I did a bet on that. So we took the Infineon platform, the 1x3, we modified it in a huge collaboration with Infineon. We did lots of changes in the power over Ethernet there. So the idea was these units now are powered with power over Ethernet, and also that helps us relay all the data. Coming back, there's no Wi-Fi, which addressed a big need in retirement homes and nursing homes, because if you think about it, if you want to put many of these devices around, you have a problem with Wi-Fi, and we all know how problematic getting access to Wi-Fi sometimes is. So we moved away from Wi-Fi. We use the landlines, which are in Canada is a must-have and those retirement homes. So we tapped into those, and from this, we had a platform that's pushing the data all the time from every sensor. Some specs about the sensor, but the beauty of this approach became evident in something like this, because when we started collecting data, we quickly realized that, oh, look at this. This person is swallowing, and the swallowing approach is almost very clearly different than the coughing. So this meant that in the cloud, we could do a new module after installation and everything, and say, oh, listen, this is the case when somebody coughs. And if we can catch that, then the device can later on report to the doctors, this person has been coughing more than usual, something is wrong, please check up. So that was the beauty of this cloud-based approach. Now, during the times of COVID, we of course got the ask of trying to monitor as many patients as possible, not just one. So we had the design before COVID, we had the ability to monitor one subject. And then the question came back and said, well, it's COVID. No, we cannot have a device per person. We actually have a space like this, a ward where it's isolated. All the people are sitting there. We need to monitor as many of them as possible. So we started looking at a class of radars where we have multiple transmitters, multiple receivers. Of course, if you add more transmitters and receivers, it becomes a bit expensive. So we focused our energy into a class called multiple input, multiple output radars, or MIMO. And the beauty of working with MIMO is in a way that, let's say you want to have 3 transmitters and 4 receiver system. So if you figure out a way to get it to operate properly in the MIMO architecture, you have only 7 antennas, 3 and 4, whereas in a traditional platform, you'll have to have 3 times 4, which is 12. So you went to 7 antennas from 12 antennas. That's a huge, huge improvement because it simplifies the overall requirement on the size of the system, the other cost-related aspects on the system. But we quickly realized a big challenge. If you're trying to put, say, the radar by the TV and to try to monitor all these subjects, there's some fundamental issues that will kick in. And basically, one of them is the fact that you start getting something along the lines of scan blindness. I don't know how many of you are familiar with these things and the antenna topology or antenna language, but just to simplify things, we realized quickly that even if we keep adding more antennas, it's not going to help us much because we cannot see beyond a certain angle or field of view. So the idea was, okay, if that's the case, we are maybe bounded to plus minus 45 degrees or so. We can stretch it to 60, but we cannot have one radar that will monitor the whole space and plus minus 90 degrees. That was not feasible. We just couldn't, like, fundamental issues were there, right? Of course, we could address that with a completely new architecture, but we said, okay, we can live with this limitation. Let's see what other limitations we will have. And one of the major limitations that we encountered as well when we were going to that MIMO architecture is the fact that packaging plays a huge role in how the system behaves. And to simplify things, in any antenna, let's say you have 3x4, and I'm picking the 3x4 because many of you who are working the radars most likely have used the TI platform, which has the 3x4. So if you look at that, you'll have some antenna coupling because of how things are designed, but then the bigger one comes in from the packaging. And the issue with the packaging there is, I think best showcased here, if you have no package, like here's how smooth the TX to RX patterns are. So you can calibrate those very nicely to get the system to behave as intended. When you add a plastic package as simple as only a couple of like few microns thick, you will quickly notice that this is the TX to RX pattern. It's completely degraded just because of the thickness of that plastic. And of course, to solve that, you have few issues or a few possibilities. One is to change the antenna design completely. Another one is, which is very common, thin the plastic as much as you can on top of the antennas. So this is, for example, a TX RX antenna array. If you can thin the plastic as much as possible, maybe that's one way. But there are other approaches, and we've been busy with these other approaches for quite a number of I'll skip through this, but for example, one of the approaches was to embed the antennas into the plastic packaging. So you have the flat antenna array, and then you have the plastic package, but then embed some type of lens into that plastic package to shape the beam and then not get deteriorated by the plastic packaging. Why we went with an approach like this versus many of you are familiar with these hemispherical lenses. You see them a lot. We actually went initially with the hemispherical lens, and then we started putting these in in the living lab, inviting people to come in. And some of the older adults actually complained a lot. They said, oh, you have a camera there. This looks like a camera. And no matter what we said about the lens, they were convinced this is a camera. Whereas when we went ahead with the hyperbolic lens, it looked more, I've seen it outside, I guess. It looked more like your Wi-Fi access points. So people think, oh, this is safe now. It doesn't look like a camera. I'll accept that. So things along these lines. So iterations along these lines were really important. And it really, I think, underscores the importance of the human factors piece, right? Initially, we were not thinking this is going to be an issue. There were other issues that we encountered, like we use these nice lenses there, but they, depending on the choice of material, they can easily showcase the blinking LEDs inside the PCB. And once you have a blinking LED, some people will look at it and say, you're monitoring me, right? So they don't want to see that. So how to address all these, lots of different designs, again, just to consider the impact of working with older adults. Again, similar to what I showed earlier with adults, before we ran a campaign with human subjects, We actually got the dolls again with on different chairs, and we showcased that we can actually catch the motion of the motors, even if they are very, very close to each other, sitting almost touching each other. And that was encouraging enough for us to go ahead and do an actual full-blown campaign. So in this case, we have the radar in the ceiling looking at different subjects and extracting their breathing rate and heart rate simultaneously in there. And from there, we got two major campaigns running. One of them was with the Canadian Space Agency. We ran this in a hospital. It was the first of its kind study on an inactivity. And we stayed over 6 months in a hospital working with different subjects. And the idea was we were collecting data using gold standards from the hospital plus our radar devices. We have lots of data generated from that study, and I made it available publicly. So happy to share that. Basically, lots of universities in Europe are using it to build on it. The dream there is, with all this radar data, it's new, right? So the dream is to latch on something that we can go back and say, if we actually saw this in due time, we could have predicted a heart attack before it happened or a stroke before it happened. So that's what we're after. The other big study that we have is we install these in retirement homes and nursing homes. We have about 500 rooms so far being monitored, and there we have the radar in the living area and also in the bathroom area. And we've been collecting data regularly. The beauty of this is not only about cardiovascular system, but we can also latch on falls, so we can flag falls as soon as they happen, which is a major issue in these establishments. The other big piece, and I'll come back to this in a second, but the other big piece is we can train the system to monitor or figure out if somebody is walking randomly, sitting on a sofa, washing dishes in a space. And nowadays we have, let me scroll through this. We have this type of dashboard. So we have, this is actually a wide lens view of the apartment. So we have inside, there's a bedroom, there's a living area, there is a kitchenette area. And basically the report comes to the staff at the end of the day. Mrs. X in room 101, she actually watched TV for 1 hour, slept for 8 hours, used the bathrooms 5 times overnight. So this is the type of report we generate. They love the bathroom report, and for a few reasons. Let me show you a couple of them. So the report that we generate specific for the bathroom is we show how often a person, of course, entered the bathroom, if they sat by the toilet area, stood by the toilet area, washed their hands, walked around, or if they fell. And what turned out to be very interesting for many of the stuff is the fact that if we can flag that the person has been using the bathroom more often than they have over like the previous weeks, this could be an indication of maybe a UTI, or it could be an indication of deterioration of the kidney functions, which could require some additional medical work. So things like this became really interesting, and this view gives you an idea of how we have been building the platform. So we have a 1x3 and most of the retirement homes, a simple architecture used in many devices, including TVs nowadays. And then we add a lens on top of it. So that's a 3D print structure to control the field of view. Runs the whole radar architecture from there, then a machine learning layer. And then from there, we can identify or classify these different use cases. We ran a workshop on campus, and that workshop included inviting several nurses from a local hospital. And we got their feedback on the platform after trying it for a while. And I got a very interesting feedback from the head nurse saying, we love the fact that you're detecting falls and all the other metrics, but we are actually very worried about the fact that the fall flag is not coming back with a severity of fall indicator. And the reason they wanted that is the fact that think about it this way, they have limited staff. If one nurse is attending to person A, and then it gets a flag that person B fell, do you leave person A for B or not? So it's a ethical question, right? And if you leave them without need, that could be a problem, liability issue later on. So you need a severity of fall flag coming in saying, most likely person B hit their head on the way down. So maybe that's a severe one. You have to take a different action there. So when they told us that, that was a big challenge because, again, remember, we're doing a radar architecture plus machine learning. Machine learning has to see things before to get trained on how a fall or how whatever incident is looks like. So for a severity of fall, now we needed to train the system how severe fall will look like. So how would the person hit their head? I'm not showing it here, but I had some adventurous old adults who came and said that I'm willing to fall for you guys for the research need, right? To hit my hip or hit my head. There were the adventurous ones, right? But again, we cannot do that legally. Let's put it that way, right? So the way we went about it is we created a digital twin piece. So we actually modeled human motion. We have there's a team in CMU. They created an amazing, nice library on human kinematics, and we imported that into electromagnetic simulators. And the idea was, let's build a model for the radar. Let's build a model for how people move. And let's see if we can get these different types of falls in. So the radar will learn from the simulation, and then we can use that in measurements. So this was the basic concept. And these are some of the scenarios. For example, here, two people are walking. This is the radar signature, somebody falling forward, falling backwards, different fall. We had a huge array of animations imported into full wave electromagnetic simulators, created a huge replica of all possible falls we can think of. Again, this is a heavy use of the advances we got like 10 years ago. I don't think this would have been possible. It's just we've been fortunate. We have lots of advances in GPUs, so we can run this in a crazy, I would say, fairly good speed. And then I showed this earlier, but we can build architectural models there. So we can put tables and all sorts of furniture that will replicate the actual environment in there. So that work now became our core in terms of detecting severity of falls in retirement homes and nursing homes. I mentioned at the very beginning, I'm going to talk about a couple of byproducts. So this is one of them. When we showed the early demo of controlling the infotainment in a car, a couple of Japanese OEMs approached us, and they were super excited about this. They wanted to put it in cars. We started a very long dialogue, and that dialogue led to them sharing some of the challenges they had at the time with different tech. One of them was trying to figure out how to count people in a car efficiently. That was one. Detect if a driver is distracted or not. That was another. But the big one, they also wanted to detect if a child is being left behind in a car. I wasn't aware of that at the time, but surprisingly, in North America, it's a big deal. People leave their kids in cars and go shopping, sometimes because they think they're going to finish shopping very quickly. And on average, over the last, I would say, 15, 20 years, we're seeing about at least 50 kids dying every year, at least, because parents either forget them in the cold or forget them on the snow and the heat, and they just got distracted. And well, they were left alone in the car there. So there was a need to detect the left behind kids in there. Of course, if you think about it, if a kid is left behind in a car, most of the times they're sleeping, so they don't want to distract them in a way, leave them sleeping. But the other piece of, in terms of tech, if you use a weight sensor, it wasn't enough. Some companies started using weight sensors, but the problem with a weight sensor, if you have a bag, for example, on the back seat, it's gonna start beeping. People were not happy. And then they started using IR sensors, infrared sensors, or like basically, if you're aware of many of the sensors in the rooms, sometimes you have them where if you're sitting not moving, the room will go dark on you, right? Just because, well, these sensors are not meant to be that accurate. So what we tried to do at the time was, okay, let's blend some of the stuff we've been doing. And the idea I had is, can we put a radar inside the car? They're interested already in one for gesture control, but can we do it so that it can detect that left behind kid or infant or pet? And of course, to solve that, it's crazy problem if you think about it, because we're doing this we're trying to figure out what's the frequency we need, what's the field of view of the antennas there. Similar to what we've done in the retirement homes and other spaces. Now you have a closed shell of metal. Inside the shell, there's lots of seats, and these seats are mostly metallic, but they have gaps. That's how they designed them in the cars. So we had to figure out which frequency we can operate at so that it still can penetrate the voids in these seats and monitor maybe a kid all the way in the third row in a van if the radar is by the rear view mirror, for example. Because the other alternative is we can put a sensor per seat, but no car maker is going to do that because, well, it's too expensive. So lots of work done in that. TI was heavily involved in this. Wire was also heavily involved in this. And just to give you an idea on how challenging this was, this is the 3x4 TI platform. If you put this inside the car and try to simply just count how many people there are, This is over almost like 5 minutes or so. And you can see the system sometimes detect 2 people, sometimes 3, sometimes 4, sometimes 5. It couldn't latch just because people are moving. And if you have the people sitting next to each other, the angular resolution hits in. It was a very interesting observation there from some of the demos we did earlier. Of course, you can solve this by going in a fancier TI architecture. If you're going to stick with TI, where you have cascading of 4 of these 3x4, so you have a very, very complex platform. The idea is now you have a much better angular resolution, but that's a very expensive platform. So the idea we tried to use is, let's do the same trick we've been doing for a while. Let's use the radar architecture plus machine learning, and that's basically the hypothesis that we built this on. And we went ahead to showcase that, yes, with an architecture, a simple architecture, actually this one was using the 3x4 from TI, we could design the antennas in a way that we have a proper field of view, proper coverage. The signals will penetrate the seats. They can even detect if an infant is under the 3rd row seat. Byproducts, we can do counting, gestures, as I mentioned earlier, and if a user is holding their phone. So all of these you can see them in different papers out there. I think the couple of interesting highlights from this, back in 2019, CNN liked this work a lot to the point that they featured it. It was a big one, and it was timely because at the time the US Congress was looking into what they call the Hot Cars Act to push some of these techs into the vehicles. Now, lots of FCC, lots of other things happening between back then and now, but now this tech is available in many new vehicles. So Toyota has them in their vans, Volvo has them in their SUVs, Hyundai has them in some of their SUVs. It became lots of people latch on it, and it's I think we're going to see more and more use cases from this tech. Along the more and more use cases is the fact that we all spend some time in the car. So even though we're talking about autonomous vehicles, doesn't change the fact that we're going to spend time commuting around, right? So whether we're driving or not, we're spending time in the car. So what if we use the car as a medical hub, right? So now we have an iteration where we place the radars. They're becoming cheaper, so now automakers are okay installing more of them. So we're looking into radars in the seats or in the wheel, and this way we are monitoring the breathing motion of passengers or drivers there. And again, if you think about what we have shown earlier in terms of monitoring older adults, we're almost repeating that, but in a car. And the whole idea is now we're generating a health record as you commute every day. And I think there would be many, many potential use cases for this. Of course, the question is, if we can do it reliably over a long period, maybe we can detect changes in cardiovascular system for a given individual, and from there flag the need for going for a medical report or medical testing and stuff along these lines. This was not trivial at all. I'm glimpsing through some of the papers, but think about it this way, that you're trying to detect the breathing waveform accurately in a car that's moving and bumping and all of that. So we had to connect the car to the car ECU to extract some of the vibration stuff so that we can correct the signal and extract it properly. So it's an interesting one. I mentioned earlier, we had the autonomous vehicle. We also now have an autonomous shuttle going around, and we made many of these sensors inside the shuttle and outside the shuttle. And I know I'm over time by quite a bit, so I'm going to scroll through one demo. We almost repeated the same work, but in mines. And the reason we did that is in mines, if you think about it, it's an environment where you can easily lose visibility because of dust and all of that. You cannot use a camera in a case of accident to find, again, where the workers are. So what we did is we actually retrofitted some of the mining equipment with the radar architecture. Same idea as what we have shown earlier, trying to basically now detect if somebody is on the ground, but they're still breathing somehow. And this is actually a case where on the left, you'll see the camera feed, on the right, you'll see the radar feed. And here's, for example, the camera. It can detect the person going by nicely. To the right, you can see the radar detecting that. And then we actually started running in a different, this is a 0 dust level. So there are 2 people. You can see the camera, radar, and LiDAR. So this should work nicely, no problem with the camera. But let's go to dust level 1. And actually, this is actually in a mine. So I created a mining simulator on campus, but we actually did data in an actual mine. So this dust level 1, you can see the camera is almost not seeing anything, but the radar, again, it's the same approaches, but you're finding a new use case. Dust level 2, again, unless they have the lamp on, you can see something there, but if they're not looking at the camera, you can never see them. And then, of course, going to dust level 3, which is really, really challenging. You almost have nothing seeing there, but then again, the radar latches very nicely. So I'm putting this out there because lots happening in the mines, and I was surprised that when we show them these demos, they loved it because again, it could be really helpful and saving lives in extreme conditions there. I know Sevgi and I chatted about other applications for some of them are drone-based applications. So just one slide there, and again, you can go through the papers, but we repeated almost all the works that I've shown, but trying to classify drones. And again, think about it this way. You have all these mini drones flying around. You can detect them, but you need to also be able to classify them. So we had the radar array plus some machine learning to teach the radar how the digital twin of these ones look like, these different drones look like. So you're seeing, for example, a DJI Phantom drone. We built the whole thing in electromagnetic tools. We built its digital twin. And then later on, we went into a test campaign to detect that based on, and classify it based on all the training that happened in the digital twin. We showcased that this is applicable even when trying to classify multiple drones incoming at you. So you could have a DJI Matrix and a DJI Phantom, and you can classify that nicely. One of the big things that, again, along the same line of thought that I showed earlier is the fact that you can detect if, let's say, that DJI Phantom was modified to be carrying a bomb. Because in the digital twin, you can show the radar how this drone signature looks like when it's not carrying anything. But now when it's carrying a bomb, for example, it will have a different signature. Now there's so many permutations out there, right? But you're doing this all in the digital twin. So you can be creative and run all of these. The system has seen it all in a way. It's like a student who's studying for everything possible there. So now it sees it in real life. I've seen this before, and it can latch on it. So I'll put it out there. And then, yeah, happy to take any questions. Thank you for your time. I'm sorry I went a bit late.
George, quick, I mean, this is amazing. There's so many different applications for radar, right? I'm not a radar guy and I'm very excited about radar. So, question I get asked sometimes, can radars be used to detect a sick person entering the room? And, or like, looks like you kind of dabble in that space. Like, what's your take on what would be needed there?
So I didn't cover lots of works, whether we did it or others did it on gates. And radars can easily latch on different gate properties, right? So if somebody is coming into a room that they cannot walk in a straight line, for example, or feeling drowsy and anything along these lines, radar should be able to catch that.
Okay.
That should be no problem. Now, the issue is really you have to, if you're gonna do this detection, you have to look at the environment itself, because let's say I'm looking at here and there's a table at the point of entry. Anybody who's coming in, and if they're older a bit and they don't see it, they may hit it. So they will walk in a weird way. So you have to design the install location in a way that is good enough to be able to make that decision. So maybe you have to go outside and put it on the hallway. So it's seeing them coming in from the beginning of the hall, give them a few meters, and this way you can latch on that. Yeah. We have work on, so again, gate is a big problem in Canada. To do a proper gate analysis, the wait time is also 12 months or so, right? And they use a mattress on the floor. That's about $30,000-$40,000 mattress. It's very expensive. It has lots of sensors and go bad easily. So in one clinic, what we did is we had the radars and we're asking people to walk back and forth, same way as they walk on the mat, but now we're detecting with the radar. But for that to work, we had to have a distance of about 6 meters. But many MDs are happy because in many clinics, that's an okay distance, right? So in the short answer, yes, it's possible with a fine print, right? And you have to design carefully.
Perhaps I can, well, you mentioned about basically the machine learning and how to really combine it perhaps on the edge or like the cloud. And in your applications, do you generally look into time frequency domain type of representations or range Doppler? So some kind of a processed radar data
Yeah,
representation?
yeah.
Or like work directly with the raw data for the machine learning? And what's your take in terms of really how to
Yeah,
put the machine
so,
where it is?
okay, so I'll jump a bit there. I don't have an answer in which approach is best. Okay, what we have done is we have tried both. So we push all the data, the raw data to the cloud. And in certain cases, we push that to the ML. In certain others, we just do spectrograms and range Doppler maps. So we clean the data in a way and push that to the ML. The ML effort when you pass on the spectrograms and the Dopplers is way less than the raw data, right? That's one thing we found. And it makes the whole problem a bit more manageable, especially when you're in a retirement home and you have 500 rooms and getting all the data from there. Are we missing data when we don't use the raw data in those? I think yes, that's why we have been looking at the raw data. It's just very challenging when you're working with the raw data. It's super challenging and brings back to the question, which ML approach would be the smartest to use in this case, right? Maybe you need to develop a new one custom for this, right? It's the problem I would say the trend in most of the time you're approaching this problem as it's an image-based problem, which I feel it's an oversimplification. We are losing some degrees of freedom when we're doing that. So, but we could achieve some interesting stuff using that approach, but I feel like to unlock the full potential, we have to design or to have to use an ML that can make use of the fact that you have all this raw data and not an image-based approach. Okay. Yes.
This is, I guess, tangential to what you're talking about. I know you mentioned you have another presentation to give on startups, commercialization. Most of what you worked with seems like it's off-the-shelf radars. When you're like for the Infineon radar, for
Yes,
instance, a lot of the work. If you're trying to commercialize the use of that radar into a certain product, like what challenges is there? Since it's not a fully designed radar hardware by just your lab, it's using a commercial product. Is there any difficulties trying to transition that?
I think it's an easier, so, okay, so for commercializing any idea, there's always a sets of challenges you have to be able to handle in a way, right? You could go and design your own chip in the radar domain. There's lots of people trying to do that. But then the immediate question from investors is why burn cash in designing a new chip, not using something off the shelf? That's the typical first question. So you have to have a very interesting innovation in that chip level to be address those investors and satisfy them in a way. I feel like we took a shortcut on that, right? We had a good relationship with some of these vendors. So we said, okay, you have your chips, you're designing them for application A. What if we figure out a way to use them for application B with almost no changes to the hardware, right? And then our own spin on the hardware. So for example, the different lenses on top of the chip to control the field of view. And then we have a different architecture that will use the data differently, right? When we approach it this way, I think we hit few birds, one stone. One is investors are not going to come back to us and say, you're replicating something out there. We're using something that's already out there. We're using the economics of scale. So if these chips are used in TVs, one thing I didn't mention that most of the smart thermostats have this tech now, right? So, and many new TVs have this tech now, right? So why TVs? Because the TVs are actually monitoring who's watching, not who's watching, how many are watching a given ad or a given game and selling this data back, right? So there's lots of these ones without using a camera, so it's still keeping the privacy. But when you think about it, these are millions of devices. So the cost keeps going down, and we're using that towards building a product for completely different application. So again, we're lowering our cost, so investors like that. Of course, the IP piece comes into play. How do you protect or how do you differentiate yourself against the competition who can do the same thing? that's a different thing you have to look at. Again, it's in the matrix, but I feel like you only go for hardware. Hardware is a very, very tough game, right? And to convince people that you want to build a new hardware, you have to have a very, very good set of reasons there. So it's, again, depending on the application, depending on all of that, it's a matrix. You check as many boxes as you can and you go for it. This answer?
It does. I guess a follow-on question.
Yeah, okay,
I know I've seen a lot of papers are trying to take advantage of like Wi-Fi,
yes,
since it's a very common
Yes.
sensor in rooms.
yes,
You mentioned TVs are starting to have radars.
yes.
Is there any ways trying to take advantage of these pre-existing sensors that are already embedded in this technology?
Yes.
And be able to tap it in the same way an app on a phone can take advantage of the sensors in it? Like, how easy is that to tap into a Samsung TV?
Yeah.
Do they have that where it's easy to access? Or are they pretty closed off currently?
Yeah, easy is again, a relative term, but there's a huge class of joint communication and sensing work that's looking for the new generations of devices that will be able to do both, the communication and sensing. And there is lots of work happening on embedding in the Wi-Fi spectrum radar-based features, so you can do both. So it's a growing area, and I think judging from what I've been seeing, for example, with the newer base stations, which have radars embedded into them, right? This is going to be an area where there would be a nice fusion of all these architectures, waveform architectures, so that the same hardware architecture is doing both sensing and communication. I think this is the future, no matter what. It's just a matter of it has to sort out, or to go back to the fact that if you think about it, lots of people make lots of profit out of certain IP protecting a given architecture to be used in a given way. So how do you solve this? And then, of course, to get all these companies to agree together on certain roadmap for joint, like look at the USB roadmaps, stuff like that. And then, of course, you have FCC, which is it. And then again, there's so many pieces yet you have to solve in the puzzle. But I think no matter what, the future is going to be the one hardware that can do communication and sensing, because there's no point of putting additional hardware on the same device. You're raising the cost. This is not the trend. The trend is to push things to the lowest possible cost, and then the same hardware doing many, many things.
Okay.
Yeah.